This is Talk Business and Politics with Roby Brock.
Welcome to today's Talk Business and Politics Daily. I'm Roby Brock. We are talking healthcare today with Marquita Little of Arkansas Advocates for Children and Families, John Burris of Capital Advisors Group, and an occasional contributor to Talk Business and Politics. Thank you both for being here.
Thanks for inviting us.
All right. It's just been a little bit of conversation for like the last 5 years in Arkansas that we've been talking about healthcare. Let's begin with what's happening at the federal level. And John, I'm going to come to you first on this. The dialogue has been as an option to repeal the Affordable Care Act, Obamacare, and replace it later. Is that good public policy?
I don't think that it's bad public policy. I think it just might be the only way to get the debate moving forward if you're Mitch McConnell.
So you think it's a bluff?
I don't think it's a bluff. I think legislators, no matter where you are, federal, state, local, deal best when there's deadlines. You know, when I was in the state legislature, I had a lot of fights with leadership, even when it was my friends, because they'd always be obsessed with how long the session would last. You know, I had to, under 90 days, under 80 days. And I always said, we're not here to, do it fast, we're here to do it right. But when you're in that leadership position, especially, and if you're the governor or the president or Mitch McConnell, to escalate it back to that level, legislators work best when there's a deadline. People work best when there's a deadline. So if you repeal and say on this date, chaos ensues, maybe it gives a deadline that gets people working faster.
What do you think, Marquita? Is repeal and replace later, is that a good, acceptable policy for you?
I don't think that it is. I think it's one thing to set a deadline. I think it's another much larger and concerning issue if we're talking about repealing without having a clear plan and a clear course forward. I mean, in addition to what this means for the people who are relying on having coverage, I think it just sends the whole insurance market and healthcare system into complete chaos. We're talking about insurers not knowing what's next and how to respond to those changes.
It does seem like that there is at least some attempt at crafting a revision to the first GOP Senate plan that was out there. At least seems to be moving forward at this point in time. We'll see if maybe something comes out later this week. Let's talk about what you maybe see as, John, as one of the bright spots of what that Senate GOP plan stands for. And Marquita, I want to hear where you think that it might be most vulnerable.
I don't think the Senate bill is as bad as maybe apparently 80% of the general public do.
I think it's 93% of the general public.
But you can't let the tail wag the dog on that one. I mean, healthcare is complex. People tend to be negative to whatever the solution is if it's changed. Regardless, as far as what the bill actually does, the foundation of it is not bad. It guarantees coverage for low-income adults, actually by two ways instead of one. Obamacare said one, through Medicaid. This bill says either through Medicaid at the normal match rate or through a private sector tax credit provided by the federal government for non-expansion states. So your state can choose to adopt Medicaid expansion permanently. It's just that the federal government's going to give you the same match rate that it gives for the age, blind, disabled, and children, which I think it's hard to advocate why able-bodied working adults should get an enhanced match rate, which is what Obamacare did. This says we're going to fund it. We're only going to fund it at the same level that we fund all the other Medicaid populations. But even if your state chooses not to expand, we're going to make sure that all of your low-income adults have access to health insurance through the private market by giving you a tax credit.
Let me interrupt you right there, Marquita. Is that your interpretation of what the bill does?
To some extent, and so I do think that the bill attempts to ensure that folks have some coverage options. Now, whether those are good coverage options, I think it's where kind of the debate falls apart. So I'd say they are not adequate or good coverage options in terms of the people who are actually receiving that coverage and what they might get, making sure that there is an essential health benefit that remains in place, sort of a minimum standard. And I also think it's a bad deal for states. Our own Governor Hutchinson, has come out with many other governors saying that the cost shift that we'd see in our state, it would just send our state budget into chaos.
He said it'd be about a $500 million hole in the state budget if that were the case. Well, let's stay on Medicaid for a second here, and let's talk about the impact on that for Arkansas and for other states. Because one of the things that's been talked about is to do a block grant to the states. What would be wrong with a block grant to the states so the state could control how it wants to spend its Medicaid dollars?
So I think one of the biggest problems with the block grant is that it doesn't actually reduce the cost of care. It just shifts that responsibility to the state, which in turn shifts it to either the consumers who are going to have to pay more in terms of what their contributions are. It shifts the burden to hospitals. It shifts the burden to physicians who
Even if the
might
money
have
is the same
reduced.
in terms of what's coming in?
Well, so the current proposal, though, in terms of the growth rate, there's a huge problem because we know that the current proposals, the amount of the block grant, it wouldn't increase in the same rate that we would expect healthcare costs to increase. And so when you come up with that shortfall, it has to be made up somewhere.
All right.
Well, let me first say that I agree with, on the first part about coverage for able-bodied working adults, even though the foundation I think is good with the tax credit or Medicaid expansion being eligible to states. The insurance plans that are out there have too high deductibles. There's too much out-of-pocket cost for a low-income adult. You can tweak all that, but the foundation is there for coverage, and that's the important part. But I hope they do address some of the broader points about affordability and the tax credit being advanced. In terms of the block grant to Medicaid, I think that conservatives have for a long time talked about if they only had flexibility, they could reduce cost. I think if I was a Republican member of Congress, I would call out every state governor and every governor and state legislator and say, fine, here's your flexibility and here's your reduced amount. They don't really even do that, though. They don't reduce the amount that the federal government's going to give to the states. They actually just give them the same amount that grows less a little bit every year. This bill does not cut Medicaid. It simply grows it a little less, and only in federal government budgeting is that called a cut. It block grants and gives the states the flexibility that they want, but grows it a little bit less than it would under a fee-for-service typical Medicaid program that we have in place now.
All right.
It doesn't cut it, grows it less. States can manage it better with the flexibility.
Let's take a quick time out. I want to come back and ask a couple questions about the Affordable Care Act and maybe a little politics that'll be more in your wheelhouse, and I won't put you on the spot, Marquita, if you don't have to. So we're going to be back after this word from our sponsors.
Arkansas Electric Cooperative Corporation provides electric energy across 2/3 of Arkansas. This is an exciting time in our energy history, with incredible progress being made in renewable energy and storage technologies. As our energy portfolio continues to diversify, we'll maintain an all-the-above strategy to provide reliable and affordable electricity. Ever since the first light bulbs were placed in our members' homes, the electric cooperatives have been the solutions provider for our members, and we want to continue that well into the future.
Each day, the promise of our nation begins again. Arkansas and America, moving forward. I help make that promise a reality. It's not for everyone, but people everywhere depend on us. Trucking delivers, or everything stops. And that's what drives me.
And welcome back. I'm with Marquita Little from Arkansas Advocates for Children and Families and John Burris from Capital Advisors Group, top business and politics contributor. We're talking healthcare here. Let's stick with Medicaid and Medicaid expansion a little bit. What would be wrong with Arkansas's private option, Mr. Architect of it over here, and Arkansas Works being a model for the nation? Would you think that that is a good blueprint?
So I do think that it could be a good starting point. I mean, we have been innovative in many ways here recently in our healthcare system over the last several years. I mean, one of the major issues that the Senate bill is attempting to address is the issue with the exchanges. We need to figure out a way to get a balanced number of healthy and unhealthy people. We need to figure out how to increase competition in the marketplace. We need to figure out how to actually get insurers to stay in the marketplace. We've done all of that with the model that we have in Arkansas, and so maybe it is a good starting point to think about how we can make some of those broader reforms in our healthcare system.
What do you think, John?
Well, I think a lot of what you said is true, which is why I go back to our first discussion over the Senate bill. The plans and the out-of-pocket and the way it's structured needs to be changed, but really if you just look at it from a foundational level, from the principles of it, it provides an access to coverage for every low-income American, whether or not your state expands Medicaid. The private option, Arkansas Works, the very premise of that at the very basic level was using a federal dollar to purchase private health insurance for a person in a low income category instead of forcing them on to Medicaid, which you do through Medicaid expansion. The Senate bill again says you can expand Medicaid if you want, or we'll give you this. And actually, Governor Hutchinson did a good job of advocating for really a third way there, which was saying, give us the dollar, but let us design the plan as we want with things like work requirements in place. There's really more options for states here, and that means more options for consumers. I think the private option at the core of its principle is really not that indifferent from what the Senate bill is, and the same with Arkansas Works with the added work requirements and things like that.
So Marquita, and then to John on this same question right here, if you could do one or two things to fix the Affordable Care Act, where this is an option that may actually begin to happen in Congress if there can't be a hyper-partisan vote on a bill, we may see some bipartisan approaches to fixing the Affordable Care Act. What would one or two things be that you think needs to happen?
Sure. So again, I go back to I think we have to address the issue with the exchanges. We expected more people to enroll in the exchange. Fewer people enrolled, and the people who enrolled are sicker. And so we have to come up with some options to help sort of mitigate or address that issue. But I think it's important to also add that the Senate bill goes well beyond fixing and or repealing the ACA and make some really harmful proposed cuts to the Medicaid program that puts kids at risk, that puts seniors at risk. And so the complexity of states trying to adjust to those two major changes to the private insurance marketplace or the exchanges, in addition to dealing with changes to Medicaid, I think it's just a recipe for a disaster.
One or two things that would fix the Affordable Care Act. Do you think it's fixable?
I do, and I think the Senate bill really goes a long way in doing it. I think you ought to let states offer coverage in the way they want, and I think the federal government ought to pick up a majority of the tab. So if we're looking for areas to agree, let's start there. Access for all low-income adults, a tab that's picked up predominantly by the federal government, but with state flexibility. Whether or not that's 50%, 70%, 90% federally paid is a debate point. What the health plan looks like that the consumer has to buy is a debate point. The reason we have too many sick people and not enough young people is because Obamacare mandated an essential health benefit model that made premiums too costly and people can't afford them. So giving options to people that are appropriate but still giving them coverage ought to be the goal. And I think the Senate bill needs changing, but I think a lot of those guiding principles are there.
All right, last question to you first, John Burris, and we'll see where you want to weigh in on this. Republicans have had almost 8 years to craft a plan to repeal and replace the Affordable Care Act, and they still don't have a plan that they can agree on. Why is that?
Maybe the first thing we talked about, deadlines. I mean, it's a lot easier to have a position when your position has no consequence. And I mean, obviously, I went through some of that being in the legislature. I mean, I think it was being against Obamacare was never a health care policy. And certainly Republicans were able to be a little lazy in that approach over the past 8 years. It doesn't make Obamacare right. It just means it takes a little bit of a deadline and a process and an urgency to actually realize what you're for. And Congress is going through that to a degree now. And I don't think the outcome will be bad. I think it will just take longer than it might have otherwise.
Marquita, give you the last word on the subject.
So I agree. Getting rid of Obamacare is more about politics than actually making good policy. And I think now it's time to actually come and do the tough work of shaping good public policy where everyone in our nation does have affordable coverage and coverage that's comprehensive and adequate.
All right, Marquita Little, John Burris, lots of fun. Thank you for keeping it civil, and it was good stuff.
Thank
Thank
you.
you.
All right. That's all for today's program. Thanks for tuning in. We'll see you next time.